Hey, we're back. I'm your host, BKP, and we're at Sycamore Crossing on this beautiful Friday morning in Blue Ridge, Georgia. It's in the 70s this morning, Dr. Whaley. It's really enjoyable.
It's gorgeous.
We're here with Dr. Whaley. It's our segment, Ask the Doc. We want to thank Georgia Cancer Specialist. And again, we're at Sycamore Crossing. What more can we ask for? Beautiful.
Nothing.
Outside.
Maybe the guy will be here with a Tupelo tea in a little while.
Yeah, that's the door.
Step.
That's the door I wait to see open in the mornings. Okay, let's say, where do we want to start? We want to go with questions, or you want to comment on the healthcare bill?
I want to start with what you said about the blue pill.
Ooh.
Because you'll notice my tie.
Yeah.
Very carefully. What does it say?
Pfizer?
Pfizer. This happens to be a tie that is all blue pills.
Oh, gosh.
And just, you began with that, and I'm wearing my blue pill tie today, so I thought I'd start with that.
Well, you understood that was directed at Nancy.
I understand.
So you're sitting over there, and I'm saying you better take your blue pill, and you're wearing a tie.
Covered with them, yeah.
Okay.
All right, the second thing was, you were talking about the four senators who are not happy with what's happening here. And I'm old. But over the course of my life, I've had the opportunity to be close to a number of legislators. The first was Ben Blackburn, who was congressman from 6th District, my father's law partner. Sam Nunn, a longtime friend. White Fowler, Paul Coverdale, Bill Frist, then Zell Miller, and then lastly Johnny Isaacson. So that's a long list of people from a couple of states. And you got, what, 3 Democrats in there, and you got 5 Republicans? No. Well, anyway, you got 5 Democrats and 4 Republicans.
You have a mix.
You got a mix. But every one of those men had the mindset that they were sent to Washington to do what they thought was right within the mandate of their people that sent them there. And I believe that they were all, on both sides, more able to sit down and say, it's time to change this pitcher or whatever, like a ball game analogy. And they could have done a better job than the legislators that we have there now. And it's gotten to be so partisan that you know good and well over here on the Democrat side, there got to be some guys who were fraternity brothers with these guys over on the Republican side.
All right.
And we know that they're playing golf together on the weekends, and we know that they're playing tennis together because we got a lot of that out of the shooting last week, that they're friends that socialize together. And if you take the House bill and you take the Senate bill, the features that they are emphasizing and that are, in my opinion, are important, and you go back to Rand Paul saying you've got to have skin in the game. I've said all along that the consumer has to be responsible for his own health care. And if he's blind, lame, sick, old, or whatever, we have to help him get his health care. And the young people who are not buying health care because they don't think they're going to need it need to be incentivized in some fashion by some sort of a penalty if they play that game till they're 38 and then they get heart disease. So both of these bills have got mechanisms to protect the poor and the disabled, but they have different amounts of responsibility for how to make the consumer have skin in the game. And Rand Paul's exactly right. If you can get people to buy that insurance and make people compete to sell it, then I've got, I think, $3,000 deductible on my truck, and I don't have collision, and you get a new truck and you get collision insurance. Exactly. I mean, it's that menu. I've made a decision about how much risk I'm willing to take on my truck, and the healthcare business needs to be like that.
Can I interrupt you just a minute? You made a decision on how much risk you decided to make on your truck, but you didn't tell me to get involved in that risk.
That's correct. No, that's right.
But that's
exactly what I'm saying. I'm responsible for that risk.
And that's where I get with people. Okay, I agree with you 100%. And when I talk about freedom and freedom is until you ask me to join you with that risk, and I didn't make the decision. That's not freedom. Go ahead. I didn't mean to interrupt you,
we're in a very diverse and appropriate community in terms of lifestyle.
Right.
And we have community leaders here who are homosexual and are in relationships, and to make that group of people buy contraceptive insurance or whatever it is doesn't make any sense.
Right.
And we've got Hobby Lobby, and to make that company pay for, they know the courts threw that out, but that menu needs to be variable enough to where a professional athletic team that's got lots of families that are in great health and lots of young kids gets really great pediatric insurance, and old folks like us, I mean, I got grandkids, but I don't have any little kids. I don't need to be paying pediatric insurance.
You know what? And people say, well, this is healthcare. This is healthcare. You cannot discuss it in the same way you discuss car insurance, and this is your health. I agree with that. But with technology today, if you went through there and you went and checked off, don't need contraceptive insurance, don't need that. That doesn't pertain to me.
Yeah, I got false teeth.
Right. Don't need that. Okay. Don't need the down. And when you get down, it takes all of that and then sends that out to 10 insurance companies, and they come back with quotes.
There you go.
More people in the United States will be insured. They can afford to be insured and have the insurance they need.
Yeah, but I'm not very smart, and I can't figure out how to do that. Ray Tidman might be able to.
You could do it.
No, I couldn't. Ray could, because he knows about computers. But anyway, that's all I want to say about that. Is that
it's like your VCR with the light flashing years ago.
Yeah.
Your grandkids will come over and tell you to quit.
I told you that already. Yeah. I can't do it myself. Anyway, I'm encouraged that the conversation's going on. I do think to have got together a bill where you can say, where everybody didn't have a chance to throw things at you, and then everybody says, oh, they're doing it under a sheet, they're doing it in a dark back room. I think the only way to do it was to do it that way, and then bring it out and let us spend a week or two fighting over it. But sooner or later, the House and the Senate are going to have to get down, and then sooner or later, they're all going to have to get in a room somewhere and chisel it out, or it won't happen. And I think Rand Paul is right. I'm right. You're right. The consumer has to be involved in paying for it and in making it priced, and he has to have skin in the game. Anyway.
But I want to ask one more question of you, because I keep saying it, we'll move on, and I'm glad you're here to answer it. I tell people all the time that there's going to be some people that are upset, and they're so far in one direction that if they just don't end everything and start over, they're not going to be happy. But what I try to tell people, as a doctor, tell me if I'm right or wrong, just candidly. In the last 8 years, Obamacare has been wove into the fabric of medical care so deep, you can't just do this in one day.
Yes.
Is that correct?
Correct.
It has to be unlaced, unraveled.
Yes, unlaced and unraveled.
Yeah,
and I think we're using the wrong words about the repeal and replace. You remodel a house, you change the way it looks, but the frame of the house and the ground it's sitting on are all the same. I mean, healthcare is healthcare. You got to deliver babies, and you got to come to end of life. How are you going to handle hospice? You've got to allow innovation. I mean, they did things this week to a colleague of mine in his heart, and he's a cardiologist that I'd never heard of and he'd never seen done. I mean, things are moving so fast. Yesterday, the FDA approved 2 new drugs to be used for a specific genetic mutation in lung cancer that is present in melanoma, and it's the drugs that were used on Jimmy Carter. And I've said repeatedly over the last year and a half, we're going to be soon to a point where we're not treating lung cancer or colon cancer, we're treating a genetic subtype. Well, yesterday, this was advanced again. This genetic subtype can be treated with drugs for an entirely different disease. So healthcare has to be able to absorb all that technology. It's extremely expensive. They've got to find some way of paying for it. But I think if you ask people, do you want to take a $100,000 a month drug when you have cancer that'll extend the length of your life by 3 months? A lot of people say no. It wouldn't buy into that option.
Right.
Anyway,
okay,
that's too
now
complicated.
this is the one I'm sitting on, and I looked at this question a couple days ago, and I thought, you know what? I wonder this all the time, because there's hundreds of millions of dollars spent on marketing when it comes to food and health benefits. So what's the difference between sea salt and table salt? And if I go over and I see chips and it says sea salt, am I better off or having sea salt on the table? Or
all right, no, salt by definition is sodium chloride, and it's exactly the same chemical. Sea salt comes from evaporating ocean.
right.
It is ground into a larger and more coarse particle most of the time. It has many minerals that are present in seawater, but it has exactly the same chemical characteristics, the same hazards in terms of your blood pressure as regular table salt, which is ground salt out of salt mines under the earth. It has some chemicals placed in it that are not much to keep it from clumping, and it can either have iodine added or iodine not added. Now, when you and I were children, there were people who had great big goiters who lived in the central United States, like Iowa and places like that were not under the sea during the periods of evolution of the earth, and therefore there's not much iodine in the ground that comes up in plants. In regions like South Georgia was totally under the sea. North Georgia wasn't.
Right, okay.
They got enough iodine. So and that was because of iodine deficiency. So the idea of adding iodine to salt, which occurred in the 1920s and 1930s, was very important from a healthcare perspective. Now, if you eat shellfish,
So that when we see salt with iodine, that was a health benefit.
Benefit, yes.
For iodine deficiency.
iodine deficiency, which
Okay,
was huge.
good, okay.
Which was huge in the mid portions of the United States and in poor communities. So that is healthy, and probably ought to use a little iodinized salt. The secret about sea salt is that it, by its texture and its larger size, it has a little more of a kick to it when you eat it, because it doesn't absorb quite as bit. And so when you bite down in that chip made at the corner down here with the vinegar and the sea salt on it, I won't advertise.
Well, you've seen me in there.
Because they don't advertise down here. Boy, that's the best chip you'll get around here. And that's the sea salt on that gives it that kind of little bitey taste as you bite into it. Otherwise, they're exactly the same. And the salt that you purchase in the store that says iodized, it's probably more healthy than the other.
So don't go and look at sea salt and
As
salt
no health benefit.
no.
Okay. No, it's not like natural or anything like that. No.
How far do we go? How far do we go in what we call sunburn? Sunburn is a big word, because was I out cutting the grass, my nose got a little red, and I needed some SP30, or sunburn's this big word where you can't even touch yourself or sit. How far do we go before we need medical attention?
That was the question. When do you need medical attention? Well, actually, the sunburn can be an emergency, and we had it here 2 weekends ago, whatever that weekend was, that was really, really pretty.
Yes.
And people were out. I don't know, what's that, Memorial Day? Or
right.
That weekend had one particular day, and I think we had one, or we maybe had two people on Lake Blue Ridge that got sunburn emergency. Okay. Now, sunburn can be from nothing but just a little bit pink, and you can forget about it. The acute burn peaks at about 5 or 6 hours. It's generally gone in 72. But if you got the big blisters on your back, you have to keep those clean, put antibiotic ointment on it, take a cold shower. That's not an emergency. What it becomes an emergency is when you get nausea, headache, vomiting, and then sort of dehydration-like things, you need, and severe pain. Those patients actually have to get hospitalized because they become dehydrated. And just put it in your mind like heat stroke. Heat stroke is you're out and you're hot and you run a temperature, then you get chills, and you know then you've got to have fluids and they got to lower your body temperature. So with sunburn, it's not that you got a body temperature of 103 or 104, but it's that your skin's on fire, you're sweating like crazy, you vomit and you can't drink, and they become dehydrated. And I think we had 1 or 2 patients that were in the hospital between 24 and 48 hours for IV fluids and for pain relief. So it's way over here on the burn side and the dehydration side.
How high would you recommend your SPF? I mean, is there times when a lower is okay if you're trying to get some sun? Or
I would tell you the truth. I'd say the answer is no. You should always use 30 or higher. But there's a great article that you can go online that was published about 3 or 4 days ago in this particular issue of Consumer Reports, and it debunks a lot of the hooey about expensive sunscreens. And I think the highest rated sunscreen that they had is a Walmart brand, and the Equate brand, and the lowest was $30 a bottle, and the lowest rated one was $30 a bottle, and the highest rated one was about $3 a bottle. So I would really encourage people. And then there's a lot of that in there about what will stick to the skin of children, what's best when you're in the water, how often to reapply it. Now, I like the spray kind because I think I get it on me better, but it discourages the use of spray kind outdoors because it blows when you're trying to put it on the kids. It blows in your face and you can inhale it, and some of the stuff in the spray is not good for you. But if you put it on your hands and then rub it on your face and do it like this and don't inhale it, then they're essentially equal. But I would say 30 is the minimum, and from there up, it's not a great deal of advantage.
Okay, now before I ask you this next question, let me set this up this way. Every week, it seems like you have a question that comes to you that seems like it comes from somewhere that later in the day they could say, I told you. Okay, we'll leave it there. So this, yeah, I think I got a small list of the ones that later in the day somebody says, I told you, and look what Dr. Whaley told you. So I just want to let you know in a nice way, I think there's this, you're being used just a little bit in one question every week, and it may be, are you understanding where I'm going?
I understand where you're going, and I did this when I was doing, I biased the doctor column for Delta pilots and FAA pilots. I did for 35 years. And I could see these questions every once in a while, so I guarantee you somebody in the union asked this question, or somebody who's married to a flight attendant asked this question, because this is really applies to the flight attendant job, and they want to go back and complain that this is anyway, so go ahead.
Well, this didn't come from the union, it came from the union president. All right. Will taking care of my teeth help prevent heart disease?
Taking care of your teeth will help prevent many disorders, but there's a difference between having them capped, having them whitened, taking care of them, and brushing, flossing, having your cavities fixed, taking care of them. Because we have many people in the rural communities who have fractured teeth, abscesses in their apices of their teeth, and dental hygiene in that extreme, and I hate to say it, is fairly common in the rural areas, diminishes some of your nutritional things. But if you have any type of structural heart disease, the most common germ that causes bacterial endocarditis is from the teeth. Now, you and I know a guy who is extremely famous and a great influence and comic writer that wrote for the Chicago newspaper. And when he came to Atlanta, back to Atlanta, he said, I'm going to have them nail my foot to the ground and I'm never going to leave. Do you remember who that is?
No, who was that? No, wait a minute.
Louis Grizzard.
Okay.
Louis Grizzard died of dental of dental abscess.
Oh.
Louis Grizzard had a bicuspid aortic valve. This is common knowledge. His bicuspid aortic valve was not giving him any trouble getting appropriate medical care. I believe he was in Russia. He had a dental abscess. Somebody messed with his dental abscess. That dental abscess bacteria seeded his aortic valve, gave him bacterial endocarditis, and as the end result of that, Louis Grizzard died. Louis Grizzard would still be alive today. He's younger than I am. And he was a very influential political commentator through humor. And he died of poor oral hygiene. So that's the answer to your question.
Okay.
Going and getting whitened, getting the, wearing braces and all that is not necessary for health. Gum health, flossing, teeth brushing, dental caries, and going to the dentist enough to where you don't have to go every 6 months and get x-rays every 12, but going to the dentist enough to prevent yourself from getting major dental fracture and dental infections extremely important.
Dr. Whaley, before we
she
go,
was right.
before we go this morning, you usually have something you want to close with, or something that we.
Well, I'll give you two.
Okay.
That came out yesterday, and I was shocked at one. And that is, and listen to this very carefully, if a pregnant woman has had an ultrasound and knows that she is carrying a male baby, she should avoid Tylenol. Now, we've talked about Tylenol.
Wait. What now? One more time.
A woman who is pregnant,
right,
knows from the ultrasound that she's
carrying
a male baby,
okay,
should avoid Tylenol.
Okay.
Not with a female baby. And it was published in the British Journal of Neonatal Psychology or something yesterday, neurology yesterday, that Tylenol affects the male fetus to the point that it diminishes the production of testosterone and decreases the masculinity of that product after birth. And nobody knows what the long-term effect of that would be, but you might as well not take Tylenol if there's any chance it'll be an issue.
Interesting.
And your Zika update is that yesterday the CDC published a survey. The number of counties in the United States that now have the Aedes aegypti mosquito is 21% higher than it was last year. So the mosquito, now not the Zika itself, but the mosquito that carries the Zika is getting to more and more places. That may be because of global warming. But during the summertime, every state in the continental United States has a Zika virus. But the number of counties in California, Arizona, New Mexico, Texas, all the Gulf, and then the mid-Atlantic states up to Rhode Island that have the Zika virus is up by 21%. Turn the water over in your yard, like we said last week. Empty the tires. It's been raining like crazy. And even if it's a teaspoonful of water sitting in your yard, get rid of it.
Okay, for the viewers out home and to you, I'm not being disrespectful to you, but we do know who's backing in right now?
Yes, we do.
Okay, so you understand, right?
Yes.
I wasn't paying attention.
Yes, I understand.
We had to keep an eye on two things, right?
Right.
Okay. Dr. Whaley.
The apartment and the wall.
Dr. Whaley, we appreciate you. We want to thank Georgia Cancer Specialist for sponsoring this segment every Friday morning. You can also find this great information, 2 or 3 questions every week. You can send questions to chief@fetchernews.com or info@fetchernews.com if you have a question for Dr. Whaley. And you can also find these segments on fetchernews.com and our YouTube channel. We're going to go to break. When we get back, I hear the all-star panel getting ready in the background. There's a noisy group, so I don't know what we're up against this morning, but stay tuned right after these messages.